Everyone, in the previous video we had studied the front of the leg. We saw the superficial fascia, the deep fascia, the vessels, the nerve supply, etc., the diagrams and other things, and we completed the chapter with the clinical anatomy. In this video we are going to start with the dorsum of foot. Okay, the dorsum of foot. What is dorsum of foot? It is the upper part, okay, the upper part of the foot. Okay, the lower part, it is in contact, that is in the contact with the ground. It is called as the sole of the foot. Okay, that is called as the sole of the foot, and it is the upper part of the foot that is called as a dorsum of foot. Okay, so dorsum and sole are opposite. Okay, dorsum is the upper and sole is the one that is in contact with the ground. So please do not get confused between this. Okay, now we are going to see what are the sensory innervations of the dorsum of foot. So there are four nerves. So that is the superficial peroneal nerve, the deep peroneal nerve, the sural nerve, and the sphenius nerve. Okay, so let's see one by one. So the superficial peroneal nerve, it is a branch of the common peroneal nerve. It is a branch of the common peroneal nerve, and it supplies all the regions except the skin and cleft between the first and the second toe. We'll see in the diagram. Okay, so it is a superficial peroneal nerve. It is the branch of common peroneal nerve. It supplies the all the regions of the dorsum of foot except the skin that is present between the first and the second toe. Now, the deep peroneal nerve, it is also a branch of the common peroneal nerve. It supplies the skin between the first and the second toe. See, this doesn't supply the skin between the first and second toe, but this supplies the skin between the first and second toe. So those are the nerves. Those are peroneal nerves. Okay, the superficial peroneal nerve, superficial. Okay, super. Okay, so it is supplying most of the region, and the deep peroneal nerve, less region. That is the skin between the first and the second toe. Now the sural nerve, it is a branch of the tibial nerve. Okay, the tibial nerve. Okay, and tibial nerve, okay, it is a branch of the tibial nerve. The sural nerve, it is a branch of the tibial nerve. It supplies the lateral margin of the foot and the little toe. Okay, the lateral margin, we all know that the lateral side we have the little toe, and on the medial side we have the great toe. So the sural nerve, it is a branch of the tibial nerve, and it supplies the lateral margin of the foot and the little toe. Now the sphenius nerve, it is branch of the femoral nerve. Okay, the femoral nerve supplies the medial margin of the foot to the first metatarsal. Okay, to the head of the first metatarsal, not the great toe, but just till the head of the first metatarsal. So see, we have four regions, that is lateral side, medial side. Lateral side we have the sural nerve, medial side we have the sphenius nerve, and to the complete dorsum of the foot we have the superficial peroneal nerve. Just between the first and the second digit, the first and the second cleft skin, we have the deep peroneal nerve. Okay, let us understand this by the diagram. So see, this is on the medial side, we have the great toe, towards the lateral side we have the small toe. So see, this is the sural nerve that is supplying to the lateral side and to the little toe. So this is the sural nerve. The superficial peroneal nerve supplies the complete dorsum of the foot except the skin between the first and the second toe. Okay, the skin between the first and the second toe. The sphenius nerve supplies on the medial side only till the head of the first metatarsal, not the great toe. Okay, the skin between between the great toe and the second toe is supplied by the deep peroneal nerve. So this we have understood by the diagram. So see, these are the regions. So see, this one, lateral side and the little toe by the sural nerve, the complete dorsum of the foot except the cleft, first and second digital cleft. Okay, that is the super peroneal nerve. This cleft is supplied by the deep peroneal nerve, and the medial side to the head of the first metatarsal by the sphenius nerve. Okay, so this is the cutaneous innervation of the sensory innervation of the nerves on the dorsum of the foot. Okay, so let us also understand the nerves. Okay, so see, this is the tibial nerve from the roots L1, sorry, not 1 2 L45S123 is the tibial nerve. Same, L45S12, not 3, only 1 2 is the common peroneal nerve, and S4 S5 S1 S2 S3 is the tibial nerve, and both together they form the sciatic nerve. The sural nerve, it is a continuation of the tibial nerve, as I already mentioned, and the common peroneal nerve gives off two branches, that is the superficial peroneal nerve and the deep peroneal nerve. The superficial peroneal supplies all the region except the first and the second digital cleft or the skin, and the deep peroneal nerve only supplies the skin between the first and the second digital region. Okay, so this is about the nerves. Now the most important artery that is in the dorsum of the foot is the dorsalis pedis artery. It's in the name itself, the dorsalis pedis artery. Now it is a chief artery, palpable artery of the dorsum of the foot. It is a chief and palpable artery of the dorsum of the foot. Can you hear the thunder? It is going to rain and I'm so happy. Okay, beginning, it is continuation of the anterior tibial artery. Okay, it is the continuation of the anterior tibial artery, and anterior tibial artery is the continuation of the popliteal artery. If you haven't seen my video, please go check out the previous video. I'll link it down in the description box as well, and please don't forget to check the playlist and also subscribe. Okay, it becomes DPA, that is the dorsal pedis artery between the two malleoli in the ankle joint. So we have the two malleoli, right? We have already done it here. So see, this is the anterior tibial artery, continuation of which artery? The popliteal artery, the continuation of the popliteal artery. Between the two malleoli, the lateral malleoli by the fibula, the medial malleoli by the tibia, the two malleoli between two, it passes and becomes the dorsalis pedis artery, and it descends forward. This is the course. Okay, this is the course of the artery. So the course of the artery is, it runs forward and medial side of the dorsum of the foot, proximal end of the first intermetatarsal space. Okay, in the first intermetatarsal space, its course is, okay, its course is there, and it runs forward and medial. Okay, now the termination, it runs downward between the two heads of the first dorsal interosseous muscle. So there is a muscle, it has two heads, and between it passes, and it ends in the sole, the termination, right? It ends in the sole of the foot, not the dorsum of the foot, the sole of the foot. If it is going downward, then it is going to the sole, right? By completing the plantar arterial arc. Okay, the plantar arterial arc, we'll see this. Okay, we'll see it in this video itself. Okay, so this is the termination by the plantar arc in the sole of foot. Okay, the sole of foot. So this is the beginning, course, and the termination of the artery. Now the relations, they are very simple. Superficially means uske upar, above that is the skin, fascia, and the extensor retinaculum. There are two extensor retinaculum, that is the superior extensor retinaculum and the inferior extensor retinaculum. So please check out the previous video to know more about it. Okay, and it is crossed by the extensor hallucis brevis muscle, crosses from the lateral side to the medial side. We will see in the diagram. Okay, so this is superficially. Deep, it is by the capsular ligament of the ankle joint. See, we are seeing near the ankle joint, so of course the ligament must be present, right? So deep is the ankle joint, and the bones are the talus, navicular, and the intermediate cuneiformis, or the intermediate cuneiform muscle. How do you remember it? The CNT, okay, the Cartoon Network. This is how you remember the bones: the talus, the navicular, and the intermediate cuneiform. We'll see the bones also now in this video itself. Now medially by the extensor hallucis longus. See, medial side we have the great toe, so extensor hallucis longus by the medially, and first tendon of the extensor digitorum longus. Lateral side we have the digits and the small toe. So the first tendon of the extensor hallucis longus, medial terminal branch of the deep peroneal nerve, as we have already seen in the above. So let us understand by the diagram. So see, this is the artery. So this is the artery, this is the skin and the superficial fascia, and this is the extensor retinaculum, crossed by the extensor hallucis brevis, and to the medial side we have the extensor hallucis longus. No, the extensor hallucis longus on the medial side, and the extensor digitorum longus on the lateral side, and downside we have the branch of the deep peroneal nerve on the lateral side. Okay, so this is the diagram. And the bones, okay, the tarsal bones, there are several tarsal bones, that is the calcaneus, the talus, cuboid, navicular, medial cuneiform, intermediate cuneiform and the lateral cuneiform. So this is on the medial side and this is on the lateral side, of course. So the calcaneus is longer, okay, it is more, it is bigger. The talus is just beside and below it, and we have the navicular and cuboid and three cuneiformis, that is the medial cuneiformis, intermediate cuneiformis and the lateral cuneiform, not cuneiformis, cuneiform. Okay, so this is about the this is about the tarsal bone. Now we'll see the branches. We are going to end the chapter soon. Okay, so the branches are, it is the branch, it is the continuation of the anterior tibial artery. It gives off two branches, the lateral tarsal artery and the medial tarsal artery. Lateral side पे lateral tarsal artery, medial side पे medial tarsal artery. Okay, there can be 2 or 3 twigs of this artery constituting the medial tarsal artery. Okay, and the most largest and chief branch of this artery is the arcuate artery. Okay, the arcuate artery, this is whatever you see here, this is the arcuate artery. Okay, on the medial side it gives off a branch, that is the first dorsal metatarsal artery. The first, because it is going to the first toe, so it is the first dorsal because we are studying the dorsum of the foot, and metatarsal artery because it is situated near the metatarsal. So it is the first dorsal metatarsal artery, and continues as the dorsal digital artery to the medial side of the great toe. Okay, the first, it is the great toe, so medial side of the great toe, of course. Now the arcuate artery gives off branches, that is the second, third and fourth metatarsal artery. See, the medial one gives the medial side, we have the first dorsal metatarsal artery. To the lateral side we have the second, third and fourth metatarsal arteries. Okay, so this is about it. So this is the second, third and fourth metatarsal artery, continues and divides between the clefts of the toe to form the dorsal digital artery, and even this dorsal digital artery to the medial side towards the great toe. So these are the branches. Now let's understand what where does it supply. Okay, the lateral tarsal artery is it is larger than the medial tarsal artery, passes over the navicular bone as we have already seen, that is on the lateral side, and supplies the extensor digitorum brevis. Okay, the extensor digitorum brevis and the lateral malleolar network. From the lateral malleolar network, the medial tarsal artery forms the medial malleolar network, and the arcuate artery, it is the largest and the chief branch of the artery and passes over the medial cuneiform. Okay, the medial cuneiform, I have already explained the arrangement of the bones, please check it once again if you didn't understand. So the clinical anatomy, this is the last part of the chapter. So this is the clinical anatomy. We see the dorsal pedis pulse. Okay, the dorsal pedis pulse. Pulsation is easily felt. Okay, pulsation easily felt between the tendon of two muscles, that is the extensor hallucis longus and the extensor digitorum longus. Okay, the extensor hallucis longus and the extensor digitorum longus. So suppose if this is your feet, too bad. So this is the lateral side, medial side. Okay, one muscle towards the medial side to one toe, great toe, that is the extensor hallucis longus, and to 4 digits. Okay, the 4 digits we have extensor digitorum longus. Okay, so between the extensor hallucis longus and the extensor digitorum longus we have the artery. Okay, this one is the dorsalis pedis artery. Okay, so pulsation is felt there. Now, absence of pulse. What happens if the pulse is absent? What causes? Okay, what are the causes? Only it is noted in the 14% of the cases. It indicates peripheral vascular diseases. Okay, peripheral vascular diseases such as atherosclerosis and the Buerger's disease or the Buerger's. How do you remember it? Just remember Buerger's disease. Okay, you're just going again and again to the restaurants, to the cafe to get the burger. So your dorsal pedis artery, it is the pulse is absent. Okay, because you're eating a lot of burger, you have to go to restaurants and cafes again and again, so your dorsal pedis artery pulsation is absent. Okay, so that's how you remember. It is due to the peripheral vascular diseases due to atherosclerosis and the Buerger's disease. It is caused by when the arteries are hardened. Okay, the arteries are hardened due to the plaque buildup. Okay, plaque buildup due to high cholesterol, high blood pressure, diabetes, smoking, obesity, etc. There can be a lot of causes, but these are the important and most common causes for the atherosclerosis. That is the plaque buildup due to high cholesterol, high blood pressure, that is high BP, diabetes, smoking, obesity, etc. So this constitutes to the peripheral vascular disease, in turn causes the absence of the pulse. Okay, the absence of which pulse? The dorsalis pedis artery pulse. So this is about the clinical anatomy, and we end our chapter here. The complete chapter is completed, that is the dorsum of the foot. In the next chapter we are going to cover the lateral and the medial side of the leg, both chapters in one video. So thank you so much. You hear the thunder. Okay, goodbye.